I'm David MacArthur with KentuckyOne Health. Thank you for joining us for this announcement today. We have a number of speakers. We're going to begin with University of Louisville Hospital President Ken Marshall.
Thanks, David. So, wow, you all showed up. Thanks very much for being here today. This is really an exciting day, not only for KentuckyOne Health and University Hospital, but also for the Louisville community. We are Louisville's only level 1 trauma center. University Hospital sees many patients who are injured through violence, and those who are here, many of them are medical providers, see how these violent acts change people's lives forever. Today we're here to announce a community coalition that puts resources together to those involved in violence to get support needed to change their lives while we make our community healthier, stronger, and safer. This initiative could not come at a more critical time. In 2015, it was one of the most violent years in our city's history in more than 3 decades. More than 80 homicides were reported in the city of Louisville alone. There were many more cases of injury from violent crimes. Local law enforcement and leaders like Mayor Fischer are working hard to prevent violence, and programs like the one we're going to talk about today will help address the core problems that are in our neighborhoods. The creation of this program is the result of dozens of people. Many of them are here today who have been working together, and we'll hear about today from those who are on the front lines of this effort, beginning first with Louisville Mayor Greg Fischer.
Well, good morning, everybody. Thank you all very much for coming out here today. You know, we're starting a new year, so a new year always gives us a lot of optimism and hope for improvement. I hope that's the case with everybody. And, you know, our city's got wonderful momentum in a lot of ways right now, from our economy to built environment to health initiative, education initiatives. In public safety, we made a lot of advances last year as well. We've rolled out body cameras to 90% of our police force now. We'll be done with that by the finish of the end of the first quarter. We instituted our 9th mobile division to focus on areas where there was higher intensity of crime taking place. And then we've trained LMPD in new techniques as it relates to 21st century policing mechanisms to make sure that each and every one of our citizens is treated fairly and equitably at all times. But still, the headline crime is homicides. And homicides, as we all know, last year was at a significant high over the last 10 to 15 years with 82 homicides last year. We all bemoan that number. One is too many. The problem is obviously each and every one of these homicides leaves behind a trail of tears to family, friends, nieces, nephews, sons, daughters. It touches the whole community when a homicide takes place. And if you are like me, when you get that news flash, it's like a punch in the gut, and you just think, man, I mean, what can we be doing? What can we be doing more to make sure that this doesn't take place? So one of the things that we can do, and it's a variety, it's an umbrella approach that we have toward reducing crime, but one of the things that we can take action on is to reach out to those who are directly involved with the cycle of violence. Our city is not alone in this challenge. The rise in homicides is a national trend, and about 2/3 of all American cities have seen a rise in homicides like what we saw here in Louisville last year. So at Metro Government, we've got a number of innovative violence and crime prevention programs. There's not going to be one that is that instant pudding. It takes a comprehensive, systematic approach. Our efforts are led out of the mayor's office by our Office for Safe and Healthy Neighborhoods. And I wanted to introduce to you all our new director who is here with us today, Rashad Abdur-Rahman. Rashad, if you'd step up and wave to the crowd. Welcome to the team. Got some hoops and hollering there. Good job. Kaniqua Carthen is with us as well. Q has been keeping our ship steady here for a long time. So Q, thank you so much. Good job. We started the office about 2 years ago under the direction of Anthony Smith. And as you all know, Anthony Smith now has been promoted. I guess we could say he's leading a national organization called Cities United. So we're proud of him. We started this work through the lens of public health. Violent crime, homicides in particular, is a public health issue. It's almost a learned issue as well. And I wanted to introduce Dr. Sarah Moyer, who's here with us today. Dr. Moyer, thank you for the work you're doing with the health department. So we've got a lot of resources from the city, but obviously this is a community effort. Some of our programs that we have involved right now are called Right Turn is one program, Re-Image is another program. These programs identify young people who've had some type of interaction with the justice system. In other words, they have a high propensity potential for being either a victim or a perpetrator of crime down the line, some of them, but not all of them. So we surround these folks with resources educationally, health-wise, community support-wise, education and employment, so we can say, let's go toward a path that has a future to it and a path that doesn't have violence involved with it. We support these programs, and we will continue to support these programs because we believe in the power of citizens to change and take control. So much what you see when you get involved with folks that are in the middle of violence is that's their learned environment. That is what they've grown up with. It could be 4 generations, 5 generations. It is as natural to them to be involved in that type of activity as it is for you all to be sitting here today at this press conference. So breaking that natural cycle, obviously, is the job of the entire community. And frankly, I believe in second chances. None of us are perfect, and it's just a shame when you see somebody that's made a mistake and that defines the rest of their life. And that usually leads to more hopelessness and more bad endings. So that's why I'm excited here today to announce a new program that takes a community-wide approach and applies it in a new, powerful way. And I got to tell you, when I walked into the room, I'm an optimistic person. I feel good every day. But, I mean, you all lifted me up because people say, you know, does anybody care about this? What are we going to do about this? Well, I mean, there's, I don't know, 150 people in here today that say, we own this. This is ours. This is our community. It's important that we work together in new and powerful ways. We understand there's not a simple solution to this thing. So I really want to thank everybody for coming here today, and I think it's symptomatic or emblematic of the broad coalition that's been pulled together to develop this new program. And this new program is called Pivot to Peace. And Pivot to Peace will focus on providing intervention, help and resources for patients age 18 to 34 who enter University of Louisville Hospital to receive treatment for gunshot, knife, or other injuries associated with violent crime, and who come from areas of our city where the statistics tell us there's a higher propensity for crime. Unfortunately, areas like California, Algonquin, Chickasaw, Park Duval, Park Hill, Portland, Russell, and Shawnee neighborhoods. Let's use our data intelligently, which we do. So we'd say, you know, here's a victim, here's a neighborhood they're coming from. They might be fine, but data indicates maybe not. Let's intervene at that point so we can get some help. We know, and I hesitate to use zip codes and neighborhood names, but it's important that we put resources where we need them. But it's also more important that we emphasize that the vast, 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 vast majority of citizens in these neighborhoods are good folks that are just trying to have a living and take care of their families and put food on the table. Okay? And that's why this work is important, because their lives are being upset and our city is being upset by really just a small number of people. When you take a look at our population of 760,000 citizens, and that's unacceptable if you're trying to live in a neighborhood and take care of your family. But too many citizens in some of these neighborhoods, their lives are cut short. I think my job certainly as mayor and our collective job as citizens is to make sure all of our citizens lead long, productive, healthy lives. And when a life is cut short by a bullet or a knife or whatever it is, we're letting each other down. So Pivot to Peace participants will be, when they receive their intervention, which will be here in the hospital, they'll meet with an intervention specialist from the Peace Education Program who will help them find the resources they need to both heal their bodies and make necessary changes in their lives so they have more and better options for the future. I'm really delighted that PSED is involved with this. PSED has been doing just fabulous work in the community for the last dozen-plus years, in the schools, in the neighborhoods. They are low-key, they are tenacious, they keep getting after it. And I joke that you guys are mainstream now when you're a part of this program. You know, some groups don't want to be seen as mainstream, okay? But I'm really glad to see the efficacy of your all's program is being highlighted through your participation in Pivot to Peace. So thanks to PSED for what y'all been doing in the community for a decade plus here. I also want to thank our funders for believing in us, to see the work that's taken place in this community. It would be easy to say this is impossible, we're not going to get involved with this. One of the things that's happened in our country, I think we've had a real awakening of our national consciousness over the past couple years that have been fueled by incidents in Ferguson, in Baltimore, by the violence in our streets. And what it has done is people have said, you know what? We own part of this too. It would be nice to wish it wasn't going on, or it would be nice to moralize from a different part of town about other people, but the fact is we are all connected. And these funders show great courage and insight when they step up. So our funders are the United States Office of Juvenile Justice, our federal government, the Geens Foundation, thanks to Geens for being here today very much, Barry and Mike, thank you guys. The Jewish Heritage Fund for Excellence, Jeff, thank you guys so much for what you're doing, to providing the funding to make Pivot to Peace happen here locally. I also want to thank members of the Metro Council who are here today to support these efforts. They're vital partners in this effort. We'll be hearing from President David Tandy in a few minutes. Councilwoman Sherry Bryan Hamilton, thank you so much for your help. Councilwoman Mary Ann Butler as well is helping us, and Councilman David James, you've been right in the middle of this work for your whole career, so I appreciate that. And then last, I want to thank our partners, the PSED program, as I've said, U of L's Commonwealth Institute, U of L Hospital, and KentuckyOne Health, who have really stepped up. Together, as you can see by our gathering here in this room, we're committed. We're dedicated to keep going forever, how long it takes. Some of these seeds we're planting aren't going to sprout up this spring, but they'll be here a year or 2 years from now. And we may not have the perfect solution today, but we're going to keep working together to figure it out. One of those leaders in our communities I'm so thankful for that's on this journey is Ruth Brinkley. She's a woman with tremendous intellect and a tremendous heart and tremendous attitude of social justice and inclusion. So Ruth is the CEO of KentuckyOne Health, and she's going to tell us more about why this is important to her team. Please welcome Ruth Brinkley.
Well, good morning and Happy New Year to each of you. Ladies and gentlemen, Mayor Fischer, partners and friends, I just want to thank you for joining us today. As you may know, KentuckyOne Health was formed to bring wellness, hope, and healing to all. And this is a part of it. We're all connected, we're all together, and we cannot be whole, we cannot be healthy unless we're all healthy and whole. We also were formed, and really about 4 years ago, 2012, we were formed to bring to make sure that the way we deliver care and services to people allows them to enjoy the best of health and well-being. Violence prevention represents one of the most essential strategies to achieving this vision. The fact is that violence is an issue of public health, as the mayor said. It is an epidemic in our nation, and it is also preventable. That's why KentuckyOne Health and one of our sponsors, Catholic Health Initiatives, have made violence prevention central to our efforts to build healthier communities. As the region's adult trauma center, I want to applaud the women and men who serve on the University of Louisville emergency and trauma teams. These folks over here, would you all please stand, all of you. I want you to know that you're my heroes, and I'm sure that you're the heroes to many in here. I hope I never have to interact with you personally, but if I do, it's comforting to know that you're there. We are just very fortunate to have them. Our dedicated staff is literally on the front lines. They treat those who've sustained violent injuries, and today we're trying to interrupt that cycle and hopefully stop some of the violence that have people end up where you all serve each and every day. While considerable research has shown that those who commit violent crimes are often and have histories of violence themselves, Pivot to Peace is going to take a bold step, a very bold step to interrupt and hopefully change this dynamic. We will now connect those impacted with caseworkers from our partners at Peace Ed, and these caseworkers will support these individuals in coping with their injuries and assist them with follow-up care so that they can link these individuals and families to participants who can help them with community resources to promote nonviolent, healthy choices and avoid further injury or negative experiences with law enforcement. We want to make sure that everyone has that access to a healthier community and healthier lives. Ultimately, then, our goal is to help participants to pivot, linking them to resources that promote a healthy, nonviolent life, and that leads to ultimately a healthy community. We know from research that most people just don't get up in the mornings and decide they're going to commit an act of violence. There's something that pushes them, and hopefully with our partners from Peace Ed, we will help people to interrupt that cycle. Success in this initiative is going to require a lot of collaboration. And KentuckyOne Health we are really proud to be a partner in this new model of care. It's why we're here. It's one of the reasons we were formed. And so we'll be partnering with a number of our local leading agencies, including the Mayor's Office of Safe and Healthy Neighborhoods, the Louisville Metro Department of Public Health and Wellness, the Peace Ed program, the Commonwealth Institute of the University of Louisville, which will provide evaluation for the initiative, and we are most grateful to our three funding partners, the United States Office of Juvenile Justice, the Gaines Foundation, and the Jewish Heritage Fund for Excellence. We could not do this without your help. Together, we will offer this underserved and at-risk population a more innovative opportunity to pivot to peace. While our medical team and our expert clinicians can save lives, it will take all of our efforts to support individuals to change their own lives and to help them pivot our entire community to a safer place along the way. Thank you for your support, and thank you for being here this morning.
Thanks, Ruth. And Mayor Fischer, I like what you said about ownership, because as we go through today and you begin to hear more about those who are involved in this issue, it really is an example about a community taking ownership for a serious problem that we have. Part of those who took ownership are people that I've grown to know over the years at Metro Council, Councilman Hamilton and James. Thank you for being here, Marianne Butler. I visit them often asking for something, and before I leave, I hope I say that, is there something we can do for you? And I'm glad through your leadership we've been able to partner with you. One of the biggest partners we've had has been President David Tandy, and I'd like for him to come up just for a few minutes to say a few words.
Well, thank you, Ken. Good morning, everybody. I think what we recognize here today with this particular program is that there's not one panacea, not one thing, not one program that is going to address the issues that we have in this community and other communities across the country as it relates to violence. And I say that not to be discouraging to folks. If anything, I say that for us to feel empowered. Because when you look at the Pivot to Peace program, what you see is a number of different entities, everybody in their own respective right and place doing their part to address this issue. So we're on the Metro Council, we play a critical role in it as well. We work day in and day out to work with neighborhood associations, to work with LMPD, to work with the mayor's office and the Office for Health and Safe and Healthy Neighborhoods, with the department, the health department, with many other organizations to do whatever we can to support the end of violence in our respective communities. We'll do that with cameras, with crime cameras that we have around town and all those other aspects of it. But the one thing that we have not talked about today is the person when we look at every morning, when we wake up in the morning in the mirror and ask ourselves the question, what is it that I can do to end violence in Louisville, Kentucky? I say that because, I live in the Russell neighborhood. My wife and I are raising our 3 kids in that neighborhood. So we interact. So I will tell you this. I got my 3. I've got my wife and I got myself. Violence is a choice. You choose to conduct a violent act or not. You're at that critical juncture where you can either decide I'm going to act on my frustrations, my angers, and my fears, or I'm going to decide that I'm going to pull back and I'm going to go and choose a different route. All of us have that choice. And sometimes the difference between pulling the trigger and walking away is something that somebody said to you at some point in time down the way. It very well could have been what some folks in our culture call Big Mama, your grandmother. Could be your aunt, your uncle, could be a teacher, could have been a coach, could have been just somebody who was walking down the street that knew nothing about you and you knew nothing about them, but they said, how you doing? Or, they did something that caused you to pull back and say, wait a minute, let me reevaluate things. That's what's going to be the critical aspect and the critical part of us being successful here in Louisville, is asking ourselves, what is it that we can do? And so my hope is that we don't have to rely upon our folks in the ER. We don't have to rely as much on the folks in Peace Ed, but I appreciate and I applaud the efforts of everybody in here who's doing that. Because what we are trying to do, what we see with violent crime, it is a cyclical effect. It's not by accident that when we turn on the news at night and they show the pictures of this was the victim and this was the perpetrator, and they both had mugshot pictures, is what they're using for it. It's because these folks are retaliating against each other for some criminal act or something that's going on. And so for us, if we want to break the cycle of violent crime, if you know somebody's committed a crime, you tell it. Let's nip it in the bud. Let's get people the help that they need so that we can move on and we can live in a peaceful and a prosperous neighborhoods. But I applaud the work that's being done here, and we stand ready on the Metro Council to do everything in it that we can to provide you with the resources, the outlets to be able to connect directly with neighborhoods and people, to let them know what's available to them, what resources are available to them. Because sometimes people act the way they do because they don't know that there's other ways or other means out there available to them to solve and resolve their problems. I appreciate the work of Dr. Eddie Woods dealing with and directly in the lives of young people to show them there's a different way. But I would encourage all of us to do our respective part, to grab somebody, a young person, and not necessarily, you're not trying to preach to them, you're not trying to parent them, as much, but what you are trying to do is be a positive example, a positive role model to them, to say, hey, look, there's another way. Have you thought about doing this? And you'd be surprised at the impact that has on people. And we will reap the benefits of our work down the line. But we have to be patient, but we have to be vigilant about it as well. And so on behalf of all of my colleagues on the Metro Council, we thank you for the work that you're doing here, not only with this program, but we thank you for the work that you're doing as citizens of our great city. And we look forward to working with you again real soon and to celebrate the reduction of violent crime in our city next year and the years to come. Thank you so much.
So one of the important parts of this program is the Peace Education Program, that Mayor Fischer and I believe Ruth mentioned. It's been around for 32 years and really is connected with the community in several locations to bring about conflict resolution and peer mediation and nonviolent intervention. Eileen Blanton has been a driving force behind Pivot for Peace, and she is the executive director of the Peace Education Program. And it really is a pleasure to have her say a few words for us.
Good morning, friends. We all have key moments when making change in our lives towards greater health is more likely. It may be the birth of a child, the death of a loved one, surviving an accident, or recovering from an illness. For young people who have been shot or stabbed, that pivotal opportunity, that key moment for change, can occur when they are recovering from their injuries. This window of time, of vulnerability, of rethinking their lives, is when our Pivot for Peace team will offer the respect, skills, and resources necessary for helping strengthen them, their families, and their community of support and commitment. Peace Ed is honored to coordinate the community-level work of Pivot to Peace. For more than 30 years, Peace Ed and our partners have taught conflict resolution, nonviolent conflict resolution skills in the neighborhoods and schools at highest risk for conflict and violence in Louisville. And I would like to take a moment for Peace Ed staff members, board, and community supporters to just stand up so that we can all, because it's a huge network of people. We have been building a network over these 33 years of people in 88 schools and 67 community sites who are committed to creating safe places for young people and adults to solve their conflicts nonviolently. These people are committed to creating islands of safety and support and the skills necessary to maintain these areas of nonviolence, oftentimes in a sea of violence. Now, Peace Ed's been around for 33 years, but 20 of those 30 years, our team of pivot leaders, so this isn't new, these folks have been working together. And the key members of this team, the key leadership members, are Janine Shakir, Dr. Eddie Woods, Deborah Barnes-Byers, and Norman Martin. These folks have been working together and separately for over 20 years to help our young people make peace the first choice. Now that's huge, folks. In a sea of violence, for young people to make peace the first choice takes a lot of support, takes a lot of skills. Words are inadequate to express my respect for these 4 adults. In fact, 3 of them are here. Norm's working another job, but 3 of them are here, and I'd like them to stand up so that we can applaud them. These are the quiet movers and shakers who have dedicated their lives to helping young people navigate relationships and systems so they can choose peace in the midst of violence. They have raised an entire generation of youth and young adults that share that commitment. And a core group of these young adults, this is one of our proud parts of this project, a core group of these young adults will be hired as street-level emergency department de-escalators, as well as pivot caseworkers. That's quite a legacy. I want to share with you the basic parts of Pivot to Peace. So we've said that 18 to 34-year-olds in these designated neighborhoods that Mayor Fischer listed have been shot or stabbed. They'll be invited to participate in Pivot to Peace by the community health worker at University Hospital, which there is a job online, posted online, right? So, here's your chance. Those who decide to enroll in the program will be paired with a caseworker from PSED. And there will be about 7 positions and a mental health counselor that are also part of this wonderful grant funding. So these caseworkers will be working directly with about 10 clients and spend about 40 hours a month over a year working with them. Now, the first goals, as Dr. Woods would say, with the participants will be to develop a stay safe plan, especially if there's retaliation, if there's a risk of a retaliation. Then the caseworkers will help participants develop short-term goals. And many of those short-term goals that our medical friends have shared with us is even getting to the follow-up appointments. And so the short-term goals will be about being healthy mentally, getting the mental health support and the physical health support that they need. After their initial work of building trust and setting goals, the case managers or intervention specialists, as we've been batting the title back and forth, will support the participant in achieving goals that can include getting a GED, taking job readiness classes, getting a driver's license, applying for jobs, attending AA and NA meetings, and introducing them to individuals and groups in the community that can help them be successful. This is why it's going to take all of us, folks, because it's going to take all of us to provide the support that can give them the hope that something else is possible. Many of these young people, these young men and women who have been shot and stabbed, have lost the hope that there is any choice other than violence. They have lost hope that our community cares. And today, I'm so thrilled with the number of people that are here because it shows that we are saying that we all care, that we are committed to their success, and that we will help them open doors that have been closed to them in the past. Am I right? Because this is not just a pivotal moment for these young men and women. It is a pivotal moment for our city as well, as Ruth said. In the midst of all the violence this year, we can wake up. We can seize this opportunity to pivot towards peace as a community, to discover together what it takes to make a viable livelihood possible for these young men and women who are at highest risk. So I stand before you sober and hopeful and very honored to be working with partners like all of you as we learn together what it takes to pivot to peace. Thank you.
Thank you, Eileen. I've been in Louisville for about 25 years, and I've seen the city grow, and I think the work that PSED is doing and the work of our next speaker, Dr. Eddie Woods, is really inspiring. Dr. Woods is from Neighborhood House, and like PSED, Neighborhood House is committed to supporting children, adolescents, and families in need for more than 100 years. The organization has provided children and families living in Portland and the surrounding low-income neighborhoods of Louisville support, guidance, and hope. Today, Dr. Woods leads the Youth Development Program, working directly with adolescents and their parents in the community to guide their future. He is an instrumental part of the Pivot program, and I invite him to share his experiences. Dr. Woods.
Okay, I'm going to try to be brief. I've got 123 seconds to get this done. So let me say, first of all, again, my name's Eddie Woods, and I'm the Director of Youth Development at Neighborhood House, where we take community safety very seriously. We have for some time now. Let me recognize some of my folks that are here. They're here doing what they do every night, and that's kind of blend in, get the job done, and don't get a lot of fanfare for it. They avoid cameras as much as possible, but I asked them to be here today, and a lot of them decided to do that. So would you please, guys and ladies, stand up and let folks see you one time. Just stand up. All right. Cool. All right. Now, I told y'all this was going to be a good party, right? Okay. Effective community safety models usually have to have two things. They have to have some level of building up protective factors and reducing risk, trying to find some kind of way to reduce risk. I believe that the Pivot to Peace program actually does that. And I don't usually sling those kind of terms and things around lightly. I learned from some folks that actually, with the Department of HUD, housing and so forth, back in the day, we had a program that actually used that particular model. Many victims of assault and their families, in their grief and trauma, look for alternatives to showing their love and grief. And a lot of times they do that in ways that are the only ways that they know. So consequently, if not impeded, then retaliation becomes their choice. It becomes pretty much how it happens. So what we have tried to do over, I guess, the better part of the last 30 years is try to find some way to get between the offenders and potential offenders and try to give them some options for making better choices. From a street perspective, this program is essential. And it's kind of a lot of years of doing this work. Big part of it was just me and a couple other people walking between buildings and those kinds of things, talking to folks. A lot of times it was just myself and Janine and folks like that, along with some new police officers at the time, David James and Yvette Gentry. They were out there just kind of helping each other and pointing out kids that needed the help. And it was going like that for a while. And then somewhere in about 2012, Sherry Bryan Hamilton and David James approached me about an idea that they had, and it was called No More Red Dots. So in essence, No More Red Dots is trying to reduce the numbers of red dots on police maps. So we started to doing that particular work and developing what would be a model. We consulted with Ceasefire International and the Youth Alive program in Oakland, California, and found out that we were actually doing a much better job than we thought. And some of the model that we were using, they adopted. So, that's pretty good stuff. You know what I mean? Think about it. Now, I've been blessed for the better part of 30 years to have come in contact with some young folks who have been survivors of gunshot wounds. And they use that experience to bring about ways to help other people. Sometimes you get a chance to save a life, sometimes you don't. But when you do, when it works out that the high hand and the efforts that we make as a community comes up with a survivor that want to help out, then that's a blessing. And such is the case with one of my guys, Karan Ligon, who's here today, and he will be available for any interviews, anything anybody want to ask him or questions about any parts of it. And we've got several young folks like that. Since 1995, when we first started doing the work, we've gotten over 112 young people involved from street activity into college. We've only had about 18 to graduate, but some of them wouldn't even had that opportunity had we not talked to them about that. They were a lot like me. I was probably the worst student in the history of mankind. And in all actuality, could not even spell college, to be quite honest about it, and didn't even know I was broke or poor until I got to college. So at any rate, I think this is the first time I've been really excited about a program since about 1995 when we did the White Fall program at that point in time. And I'm excited about it because the only way that we impact changes in violent behavior is when everybody gets mad. Everybody's got to get mad about it, just like we did with cancer, with smoking, with drunk driving. When everybody gets mad, then we see the thing kind of turn and kind of change. I see a lot of faces in the room that have been around for a long time doing this work. And this is the first time that I've seen all of these faces at the same party. This is cool. Thank y'all.
Thanks, Dr. Woods, and thanks everyone for their efforts in this partnership. Pivot to Peace is designed to help people understand the impact of their choices, and it helps provide a way forward through job training and other areas to allow change to make our city safer and stronger. So as we close today, I want to thank everybody who has been involved in making this day and the Pivot for Peace program possible. I also want to invite everyone up here, Mayor Fischer, Ruth, to help unveil our logo for Pivot for Peace.